Can you imagine 62,000 hours have been volunteered in 2009 in Franciscan Skemp Healthcare? And here with me is Elaine George. She is the coordinator for volunteer services at Franciscan Skemp Healthcare. And Elaine, I can't believe that's a lot of hours that are volunteered by people. How important is it to have volunteers at a hospital like Franciscan Skemp?
Well, our volunteers, and we had 829 last year, really make it possible to provide lots of extra services that add to the quality of care, not only for our patients, but for their visitors and family members as well.
Let's talk about for people who always looking for something to do. Maybe they're retired, maybe they're at home, looking for something to do. What are the benefits for people who want to volunteer?
Well, it really depends upon their age. If they're students, it's an opportunity to build their resume, explore health careers, and get ready for college. For adults, it's a little more complicated than that, and very important that everybody be matched to an area that they're interested in. I think most of our adults volunteer because they feel that it's a way to give back to the community, and it's human nature to want meaningful activity. And volunteering is certainly a way to use your time to make a difference for good. And just because people are retired doesn't mean from being paid, they're not retired from life. So they enjoy being with people, and volunteering is an opportunity to do that.
You really don't have to be a people person per se. It just looks like something to do.
Well, it depends very much on the person. You know, some people want to be out in the public and have a lot of patient and visitor contact. Others prefer to work behind the scenes and maybe do data entry or help in an office area. So as a beginning, my first question is always, what brings you to me? Because it is important that people like what they do and that it's at a time that works out well for them.
829 people. Has that number grown over the years?
Yes, actually, we usually have about 250 new people every year.
Wow.
So the number does, you know, it's generally right in that area, yes.
And then, you know, you said you talked about all ages, but what types of varieties of things do people do? I mean, you talked about a couple of things, but what in general do people do?
I've thought about that a lot because really there are two big groups of volunteers that we have. Some are people who provide direct services to patients or visitors. Others are people who help with fundraising. As you know, we have an auxiliary that does fundraising. Last year they raised over $158,000 that went not just to our organization but to the community as well. In May they'll have their 30th geranium sale, and all of that money goes to nursing scholarships. So those are the fundraisers. But then the volunteers who provide the direct services are people you see in our buildings. They might be in relative waiting rooms, in surgery, ICU, endoscopy, or they might be transporting patients in wheelchairs from physical therapy back to their room. There are a wide variety of areas. Probably those areas that have the most direct patient contact are areas like hand massage. And we do have a training coming up for that in May. So we're happy to have people start with us if they're interested.
And so, I mean, there's just a wide variety of things that people can do. And they're not stuck just doing one thing. They can maybe do different things every once in a while.
Well, yeah, it depends on the individual. And the goal is to match the person with the needs we have. Most of our volunteers volunteer 3 to 4 hours once a week. No one is there 52 weeks of the year. There are some people, when I see them, they are better than a robin because they've come back from several months in a warm climate. And others who volunteer as much as 20 hours a week. Last year we had 3 people who volunteered over 1,000 hours during the course of a year. So that's pretty terrific.
And you can never have enough volunteers, can you?
No, but we cannot place every person who's interested either, because probably the most valuable skill for someone to have is the ability to transport a patient in a wheelchair. Because as you might expect, in a hospital setting we have lots of people who at least temporarily need a wheelchair. And so the volunteers help them get from inside the door to wherever they need to go next.
And at least the Franciscan Skemp Healthcare, you can figure out who the volunteers are by
a burgundy jacket, usually a vest or a jacket. We have tags who wear white polo shirts. It is important that they be identified, and these are all folks that go through background checks and an orientation and health screening. So if someone wants to volunteer with us, they have to begin by calling our department, 392-9766. And hopefully we can connect them. If someone has a student who's 14 and 15, the summer is the only time that they can start with us, and we have a training coming up in June. So that group, those parents are, and it's usually their idea, is a group who should make a contact soon.
And so, I mean, this is the time maybe to start thinking if you're a child that age or parent looking for something for your kids to do this summer.
Again, meaningful activity.
Exactly. You know, you've done this for a long time now. For yourself and maybe for those who may not fully understand or have not volunteered themselves, what do you get personally from volunteering? Well,
the volunteers who've been with us the longest would say that they feel they get more out of it than they give. And to me, that's a great sign. It should be mutually beneficial. If someone's in an area that they don't enjoy, they don't look forward to coming back to that area, that tells me that it's not a good match. Satisfaction is probably the best outcome from volunteering, that sense that you're using your time in a way that's making a difference for good.
And I would have to say, by seeing all the volunteers, they almost always have a smile on their face and welcome to help you out.
They should be positive people who are ready to meet and greet and know that at Franciscan, whether we're employees or volunteers, it's all about service. And we work as a team to serve the people at Franciscan.
If you see this one smile, you can tell that smile rubs off on everybody out there. So, Elaine George, thank you very much for coming.
Thank you. Appreciate the time.
And that's all the time we have today. Thank you very much for joining us on Several Rivers Health. I'm Rick Tisi, your host. Be healthy, everybody.